Hello, my name is Ellie Kakudi, and today I'm here to talk to you about the importance of medical screening by physical therapists during the assessment of their patients. Before treating any patient, it is a physical therapist's job to ensure that the patient is an appropriate candidate for physical therapy treatment. We must therefore identify if the patient's symptoms and impairments are caused by biomechanical or neuromusculoskeletal problems before we begin any treatment. We must also take the time to rule out if the patient's symptoms are caused by a systemic disease or disorder. In this presentation, I will discuss what a physical therapist does and the conditions they treat, why medical screening is an important part of a physical therapist's overall assessment process, and associated diseases and disorders related to low back pain. Currently, in the United States, there are over 312,000 physical therapists, and they work in approximately 38,800 clinics. Each therapist treats anywhere between 100 to 200 patients per week, which adds up to over 300 million physical therapy sessions annually in the United States. The common conditions physical therapists treat are related to the lower back, knees, and shoulders of their patients. Patients often assume that the causes of their symptoms are caused by neuromuscular conditions such as sprains, strains, poor posture, and arthritic conditions. However, viscerogenic problems and systemic conditions such as cancer and infection can also mimic the same neuroskeletal dysfunctions physical therapists treat. For some of the patients, the underlying cause of their symptoms can therefore be more serious and can lead to life-threatening issues and severe disabilities. When patients present at primary care clinics with low back pain, often systemic conditions present themselves as neuromusculoskeletal dysfunction. When reviewing the causes of low back pain, Harvick and Devo found that 4% were caused by osteoporosis-related fractures, 1 to 2% were caused by traumatic fractures including spondylolisthesis, 2% were caused by visceral diseases, 0.7% were caused by cancer, and 0.5% were caused by infections. Enthoven found that amongst patients 55 years or older complaining of low back pain, 6% were diagnosed with underlying pathologies which were causing their main symptoms. Therefore, it is very important for physical therapists to screen for medical conditions to detect systemic diseases masquerading as neuromuscular dysfunction. With medical screening, the primary objective of the physical therapist is to decide whether to treat, refer to a physician, or to start treatment while referring patients for an assessment by their physician or other medical specialists. Early detection and referral to the physician are key to preventing further significant comorbidities, complications, and even death. A physical therapist will need a detailed description of the symptoms to properly screen their patient. Therapists must ask questions related to the location of the symptoms, most likely using a body diagram, the description of the symptoms, is it an ache, shooting, burning pain, or is it numbness or weakness? When and how the symptoms began, including how the symptoms fluctuate over a 24-hour period, what makes the symptoms better or worse, and if the symptoms move or spread up and down the body. All these questions are critical to the screening process. In this talk, we will focus on low back pain and associated diseases and disorders that mimic neuromusculoskeletal dysfunction. The following findings are red flags for low back pain caused by cancer. If the scores for standardized outcome measures are uncommon for the type of symptoms the patient presents. If the patient reports their pain is constant and does not improve with changes in position, or that there is a lack of improvement in their symptoms with medication or treatment. If the patient is older than 50 and has a history of cancer. These findings should increase a therapist's index of suspicion that the patient's low back pain is caused by a systemic condition, especially and specifically cancer, and is not related to a neuromuscular skeletal condition. The following findings are red flags for low back pain caused by an infection. A recent bacterial infection such as urinary tract or skin infection, a fever, or a patient is taking antibiotics, intravenous drug use or abuse, an immunosuppressive disorder where the immune system attacks healthy cells. Does the pain ease when they are resting in a comfortable position? A negative response to the first three questions decreases the suspicion that the back pain is related to an infection. However, suppose the fourth question is a no. In that case, it will increase the suspicion that the back pain is not due to a musculoskeletal impairment disorder, because pain related to a musculoskeletal disorder is typically eased when the patient rests in a comfortable position. The following findings are red flags for low back pain caused by spinal fractures. If the onset of the pain is caused by any trauma to the spine. If the patient has any history of osteoporosis, because minor strains or falls may produce an unsuspected spinal fracture. If the patient has a history of other disorders that increase the risk for decreased bone density, such as renal failure, chronic GI disorders, or chronic use of corticosteroids. And if the patient is older than 55 years old and answers no to these three questions, there is a decreased suspicion of fractures causing the patient's low back pain. The following findings are red flags for low back pain caused by cauda-equina syndrome. Any recent onset of difficulty with retaining urine or starting urine flow. A recent need to urinate more frequently. Weakness in legs when walking or climbing stairs, or a recent onset of numbness in the area of the bottom or the pubis. A positive response to any of these questions increases the suspicion that the patient's low back pain has a cauda-equina syndrome. I hope that I was able to demonstrate that the medical screening process is a necessary part of a therapist's assessment procedures. This is so that a physical therapist can decide if the condition can be treated by their intervention. If not, should the condition be evaluated by a physician or other medical specialist? It is important to note that low back pain is a common condition treated frequently by physical therapists, and often the cause of the patient's low back pain is neuromusculoskeletal. However, in 6% of the patients with low back pain, causes could be underlying pathology. Therefore, physical therapists should spend time doing their screening and medical screening. Thank you for your time.